Hey, my name is Aubrie. Today I'm going to be inserting an IV. Today is 5:31, so let's begin. Okay, so before we begin though, I do want to check my physician's order and verify that I have all my correct supplies and equipment ready. I'm going to go ahead and provide as much as possible to prevent infection, so using aseptic technique. And so then I'm going to go ahead and wash my hands before we begin. So I wash my hands, alrighty. Now I'm going to go ahead and enter the room. Knock, knock, knock. Hey, my name is Aubrie. I'm going to be your nurse taking care of you today. We're here to start an IV per the doctor's orders. It should only take about 10 to 15 minutes max. And then before we begin, can you tell me your name and your date of birth? Okay. Do you have any allergies, latex, adhesives, medications? No? Perfect. All right, so for my comfort of my patient, I'm going to go ahead and make sure that they're either laying down supine, or I can sit them up, whichever is most comfortable for them. And I'm going to go ahead and expose the non-dominant arm. Okay, so once I do that, I'm going to go ahead and put down a safety pad underneath of their arm as well. All right, and like I said, this is a non-dominant arm. I'm looking for a vein that's going to be most straight. I want to choose the most straight vein, so if I'm looking at this arm, I'm going to go up. I'm choosing this vein since it's most straight, excuse me. And once I do that, you can also check with your protocol at your agency if you need to shave the arm, if it's really hairy or whatnot. Like I said, the bed protector is underneath in case there's any blood, and now we can go ahead. So the patient is in the dependent position, their arm's exposed. I'm gonna go ahead and put the tourniquet on. I'm gonna tell my patient it may feel tight. I'm gonna put this about 4 to 6 inches proximal to the site that I chose. And so when you are putting your tourniquet on, you wanna make sure that you loop it enough that it's gonna have you'll be able to snap it off with one hand. Okay, so we'll put this on. It's gonna feel tight. Ooh. Just like that. All right, so now that's out of the way. For my elderly patients, I wanna make sure that I'm not using a tourniquet because we wanna maintain that skin integrity as much as possible for them. So now we're gonna go ahead and we're gonna palpate the vein. We're looking for a rebound quickly, that it's bouncy. If you don't feel that, you can massage upwards towards their heart to get that blood vessel dilated. You could also have your patient open and shut their fist to clench it as well. So lightly palpate. I feel it. In this arm, I feel it. If you didn't feel it, you can go ahead, unsnap the tourniquet, apply warm compress for 10 to 15 minutes, look at the other arm. Okay, so after I've selected my vein and I've chose that site, I'm gonna go ahead and remove the tourniquet. So I've already done that, and then I'm gonna get ready to set up my IV administration. So I'm gonna go ahead and choose the appropriate catheter site for the vein. So I'm gonna use a 20 gauge needle. And then if there's any solution to be infused per the doctor's order, I would also check that. I'm gonna perform hand hygiene. And then I'm also going to use aseptic technique throughout the time, performing and opening the equipment, getting everything set up per the manufacturer's recommendation. So with my catheter, my tegaderm, and my extension tubing as well. Okay, I'm also going to go ahead and just flush the extension tubing. I would have that done, and I flushed it, and then I'm going to go ahead and put my gloves on. Okay, and so when I do that, I'm going to get ready to put the tourniquet back on. Okay, and so then once I'm gonna do that, I'm gonna go ahead and get my aseptic swab. I'm gonna put it on where the site is, and I'm gonna use in circular motions. I'm gonna make sure I'm using circular motions starting at the site and working outwards several inches. I'm gonna allow that to dry, and then I'm gonna maintain sterility. Okay, so I'm gonna go ahead and maintain sterility throughout this procedure. I'm gonna use my non-dominant hand and pull the skin taut. Okay. I'm gonna use my non-dominant hand, pull the skin taut. I'm gonna go ahead and make sure I'm not contaminating the insertion site. Once I do the needle, I'm using it bevel up, and I'm gonna go ahead and insert it into the skin about 15 to 30 degrees. And I'm gonna tell my patient you're gonna feel a big stick. So once I do that, I'm gonna go ahead, and it's going into the skin, into the vein. Okay, once blood appears in the lumen of the catheter, which is flashback, I'm gonna lower the angle of the catheter, and I'm gonna go ahead almost parallel with the skin. I'm gonna advance the needle. I'm advancing it about 1/4 of an inch further. I'm holding the needle steady. Here we go. I'm holding the needle steady, and then the hub is at the venipuncture site. Okay, and so if a hematoma was to occur, I would go ahead, release the tourniquet, I would remove the needle and start again. All right, so now I'm gonna go ahead and release the tourniquet. I'm gonna go ahead and put pressure on the vein proximal to the catheter to eliminate or reduce any type of bleeding or oozing. I'm gonna stabilize the hub with my thumb and index finger, and I'm gonna go ahead and remove the stylet. All right, once I've done that, I'm gonna go ahead and connect the tubing to flush it. Okay, and so I'm gonna go ahead and flush it with normal sterile saline. And while I'm doing this, I'm just making sure I'm assessing the patient's skin for any burning, stinging, leaking, swelling at that site. If that was to occur, it would be unsuccessful and I would have to start again. So now that I've inserted the IV, I'm gonna go ahead and put on the Tegaderm. So with this Tegaderm, I'm gonna cover the insertion site with this sterile semi-permeable Tegaderm. All right, go ahead and cover it. All right, and if the site isn't clean, I would go ahead and clean and dry the skin with like a 2x2 or an aseptic swab, and I would allow that to dry. But this was dry before, so we went ahead and put it on. And then I wanna make sure that I label the dressing with the date and the time of the insertion, the catheter size, and then my student initials. All right, I can discard that. And then last thing I wanna do is I wanna loop it. If there's any tubing, I would loop it and just tape it away from the patient. Okay, so now we're gonna go ahead and take the tourniquet off and discard of that. Once we do that, I'm gonna go ahead and take my gloves off and wash my hands. All right, I'm checking the surrounding area. I'm gonna clean up all my supplies to dispose of them properly if they need to be put in the sharps container. And I'm also gonna clean up any blood spills per your hospital's protocol and whatnot. Okay, so after I've cleaned up all my supplies and disposed of any blood according to my hospital's policy, I'd go ahead and put my patient back in the most comfortable position for them and make sure that the bed is locked in the lowest position, as well as making sure that their call light is within reach and any personal belongings are within reach as well. I'd go ahead and wash my hands. All right, so I would perform AIDIT. Hi, my name's Aubrie. I'm here to take out your IV today. I'm gonna go ahead, before we begin, wash my hands, put on my gloves. All right, and so while I'm doing that, I'm also checking the physician's order and I'm gathering the correct equipment that I will need to remove her IV. Okay, and so before we do this, I'm gonna stop any infusions that are going, and I'm gonna disconnect it from the catheter as well. So if there are infusions, I'm gonna stop them. All right, I'm gonna pull this tape off. Just get that out of the way. All right, and so what I'm gonna do is I'm gonna pull this skin taut, and I'm gonna go ahead and take off . I'm gonna apply some pressure just in case while I remove that. All right. So now I'm gonna go ahead and remove the catheter and the needle. All right, so I wanna inspect the catheter and make sure that it came out correctly. There's nothing missing, its integrity is correct, and I'm gonna dispose of it appropriately. I'm applying pressure to the site. All right, now that I applied pressure, okay. I'm gonna take off my gloves and wash my hands. And then, so for documentation, I'm gonna go ahead and document the date and the time of the removal, my initials, the site that I removed it from, the number of temps, patient teaching, the patient's response, also if there's any dressing that I applied to the site, and then the type and size of the catheter. That's it.